Hello and very good evening, friends. If you are able to hear me and see the screen, just send a thumbs up somewhere on the comments or somewhere. Uh, Hi, friends. Very good evening. Very good evening, everyone. If you are able to hear me or see me, yeah. So this is just a lot of messages had come, and also from the Telegram group, I made a poll like how many students would be interested in this video session about Pixelosis. So, sir, can you please make a PDF of all the important formulas? Jay Munot. Yes, Jay, I can definitely make that. I can definitely do that. And I will be sharing that PDF on the Telegram group. So if you have not joined the Telegram group, please join in on the Telegram group. My Telegram group is by the name of Telegram group is by the name of Mukhmohit 01. So just search for PSM by Mukhmohit. Uh, if you're able to hear this, see the screen and hear me, please send me a thumbs up so that I can at least start on. Okay, very nice. So hi everyone, hello everyone. Yeah, I think you are able to see this, and any other doubts you have, you're most welcome to ask today. Today is the last session for at least before the INICET exam. But before I take on this session, I would just like to tell you that this should be your full throttle week. Yeah, कुछ days जो आप रह गए हैं. So this should be like going in full throttle. You should not leave any stone unturned. Whatever you have revised, make sure that you are doing that, and whatever you are जो चीज़ आपका पेंडिंग है, so make sure that you just complete that in a very fast forward mode. So this exam, whatever you have revised, this exam is something like ये जो INICET अभी समझ वाला आएगा, मोस्टली सब रिपीटेड टॉपिक्स होते हैं. सो जस्ट स्टे काम, स्टे फोकस बेटा. यू हैव डन अ लॉट ऑफ हार्ड वर्क एंड यू हैव एक्चुअली earned your seat already in your INICET exam. So whatever it takes is पूरे टाइम पे बिल्कुल काम रहना. आपने पूरा तैयारी कर रखा है, एंड प्लीज गो विद योर फुल स्पिरिट्स. So any doubts, you are most welcome to ask me on the YouTube or on the Facebook, wherever you are watching this video right now. So let's go on and take on the first image based question. What do you think this is? Beta, this image is from what logo? This image is from what logo? This image is from CRS, that is Civil Registration System. Civil Registration System. Beta, CRS, they had given us the total crude birth rate and the crude death rate very recently in year 2021 and 2022. We got the latest data from CRS, Civil Registration System. So it is ongoing birth and death registration system. Birth and death, they all should be registered within 21 days. Point number 2 is, what is the current birth rate in India? 19.5. What is the current death rate? That is 6.0. The infant mortality rate that you're going to remember for your exam, that is 28. The neonatal mortality rate that you're going to remember for your exam is 20. And the and the under 5 mortality rate that you are going to remember for your exam, it is 32. So neonatal mortality rate is 20. Under 5 mortality rate is 32. And the maternal mortality ratio, that is 97. Also, please note that SRS, Sample Registration System, that is one of a very beautiful or very good registration system that we take up for understanding the mother and child health indicators. Let us go to the next logo or the next point. Please note that this is the symbol for NLEP, and I think I had shared a flashcard on leprosy just very recently, a week ago, and we have also discussed during our INICET PSM Punch modules, the 4 modules. Beta, all those who are attending this video or who are seeing this video for the first time, it is just for knowledge for you that I have already completed all total PSM in these 4 video lectures. So you can just log on to the YouTube to my YouTube channel, and you can see the previous You can see the previous videos. It's very important. Leprosy, I can guarantee you one question. So one MCQ you will get on leprosy in this INICET exam. It is very important. Leprosy is important. What is this lotus flower? Lotus flower. This is a lotus flower. It represents the leprosy patient. Lotus is a symbol of purity, and lotus is very important symbol for the whole society. And that's what this logo also says. That says that the leprosy patient is a useful member of the society. That is what this lotus flower means. The ray of hope, which Arun Sharma you are writing. So ray of hope, ray of hope, that is what is the multi-drug therapy. Today also on Telegram group I got this doubt where we had discussed about how to differentiate between posse and to differentiate between multi. So all the students who have not yet logged into the Telegram, ek dafa log in karo and just see what are we topics or points we discussed about leprosy, about diagnosis of leprosy. Please note that how to diagnose leprosy. Leprosy has three cardinal features. It has there could be a skin hypopigmentation or there could be hyperpigmentation, whatever it is, with loss of sensation. So important is not about pigmentation, important is about loss of sensation. So if there is loss of sensation with hypopigmentation or hyperpigmentation, that is important for us. That is hypopigmentation or reddish patch. That is cardinal feature number one. Second feature is thickening of nerves, not the thickening of nerves. It is thickening of nerves with loss of sensation. So that loss of sensation is one of the very important cardinal feature. Loss of sensation with skin involvement, loss of sensation with nerve involvement. This is two important cardinal feature for leprosy. And the third feature is acid-fast bacilli from the lesion side. So not from the skin biopsy. That is what the doubt was today on Telegram group. That is what we had discussed. So these are the three cardinal features. The three cardinal features for leprosy, that is regarding the skin lesion with loss of sensation, nerve thickening with loss, and acid-fast bacilli. So the MDT, I think everybody knows we have two types of drug regimes we have two types of drug regimes. We have two types of drug regimes for sorry. So please note that we have two types of drug regimes for leprosy. The first drug regime that we have is a WHO regime. The WHO regime is a 3-drug regime for both for posse and for multi. The posse will take for 6 months and the multi will take 3-drug regime for 12 months. Whereas in National Leprosy Eradication Program, we have 2-drug regime, that is rifampicin and dapsone for possibacillary, and we have 3-drug regime for multibacillary. Please note that in all cases, of leprosy, we are going to give, the chemoprophylaxis. The drug of choice for chemoprophylaxis is single dose rifampicin. And to those patients who are having maybe resistance to any of the drugs, it could be resistance to rifampicin, it could be fluoroquinolone resistance, it could be anything. The second line of drug that we have is moxifloxacin, or we can use moxifloxacin for in cases of resistance to rifampicin, or we can have resistance to clofazimine and so on. So the drug of choice for chemoprophylaxis, single dose rifampicin, that is the single drug of choice. It's important for us to remember one question is guaranteed from the topic of leprosy. Next in line you have is IDSP. What is this logo stands for? This logo means IDSP. What do you mean by IDSP? Integrated Disease Surveillance Project. IDSP stands for Integrated Disease Surveillance Project. Under the Integrated Disease Surveillance Project, or it has been renamed as the IDSP program. Under the IDSP program, we have S, P, and L. S stands for syndromic surveillance, P stands for the probable case surveillance, and L stands for the laboratory case surveillance. The syndromic surveillance is done by the health workers. The probable case surveillance, that is done by the medical officers. That is done by the medical officers, and the laboratory surveillance is done by the laboratories. How many health workers syndromic surveillance, how many syndromes are taken up under the health worker surveillance? That is the syndromic surveillance. Please note, it is syndrome of fever. There are 6 syndromes: syndrome of fever, syndrome of cough, syndrome of diarrhea, fever, cough, diarrhea, acute flaccid paralysis, jaundice. So how many did we do? Fever, cough, diarrhea, AFP, acute flaccid paralysis and diarrhea, and jaundice. And last is unknown or mysterious death. Unknown cause or any mysterious death if it happens. Any mysterious death if it happens in the village. Everything is given by the syndromic surveillance. So very nice, IDSP. Very good. So very good, Arun Sharma. That is P form and S form. So Ankita Chopdar, sir, do we need to remember the blister color pack of leprosy as well? Beta Ankita, it is so easy to remember about the blister packs. It is super duper easy to remember about the blister pack. You already know that a person could be adult. You already know that a person could be a child. If the person is adult, there could be a possibacillary leprosy or there could be a multibacillary leprosy. Am I correct? So there could be possi or there could be multi. Right? So next is in case about the possibacillary for child. If you talk about the possibacillary for child, it is a blue color blister, and for multibacillary child, it is a brown color blister. So how I have remembered it is super duper easy. It is B for brown, B for blue, B for baby, B for brown, B for blue, B for baby. And for adults, it is common sense. For possibacillary, it is a green color blister, and for multibacillary, it is a red color blister. So it is super duper easy to remember for your exam. Sir, while doing INICET PYQs from Marrow, there was no logo questions or international health or national health programs from past 5 years. Is it less important for INICET? Yes or no? Yes, I definitely think for INICET, logos are of less importance. But today's topic, see, I don't know like what is going to come in the exam, but for today's topic, I'm not discussing just the logo. That's what I'm trying to tell you, that I'm not saying that there's the logo for IDSP. That's it. Remember, I'm trying to tell you the logo, and also I'm trying to explain to you the IDSP phenomena or the things. So I'm not saying that logo will not be asked. I'm not saying that logo will be asked. But my main purpose is with the logo, I'm discussing a lot of here and there important things. So I have taken it that way. So that's what I wanted to tell you, Dr. K. That was your question. So that is regarding IDSP. Next in line, what do you think this is? This is a logo for, you need to remember this, beta. This is a new updated logo. We have a new updated logo. This is the national program NPPCDCS. It is National Program for Prevention and Control. It is the only program which has the name of prevention and control. You already know there is National Vector-Borne Disease Control Program. There is National TB Elimination Program, National Leprosy Eradication Program, the National Polio Surveillance Program. So it is important for you to remember the third words everywhere. National Leprosy Eradication Program, National Vector-Borne Disease Control Program, National Program for Control of Blindness. You have the National Polio Surveillance Program. And now there is a first program that you are hearing right now, that is the National Program for both things, prevention and control. It is National Program for Prevention and Control. National Program for Prevention and Control of diabetes, coronary artery disease, and stroke. So now they have also added another C component. That is what the update is. Another C component that is added over here is cancer. Another C component that is added over here is cancer. Please note, what is the most common cancer in females? It is breast. What is the most common cancer in males? It is oral cancer. So very important, the most common cancer in males is oral cancer. It is not lung cancer in India at least, and in females it is the breast cancer. It is not the cervical cancer. Overall, if you see without the gender, which is the most common cancer, it is the breast cancer which is the most common cancer. Cancer is important in India. Cancer prevalence and the cancer incidence is important in India. So WHO questionnaire, control no problem to the society. Yes, control is no problem to the society. Very nice, Arun Sharma. Cancer breast service, yes, that is the system that we have. There is also, you should remember that for hypertension, you should know for hypertension, there is a phenomena called as tracking of blood pressure. You should note that there is something called as tracking of blood pressure. It is basically a primary level of prevention. It is not secondary level of prevention. It is primary level where we are doing BP checking, or we are doing blood pressure checking. In children onwards, we teach them physical exercise, we tell them about nutrition and diet and so on. So that is what is tracking of hypertension. For hypertension, you have a diet, special diet called as DASH diet. In DASH diet, how much should be the fat intake? It should be less than total percent of the total percent of the diet should be less than 10% of the saturated fat intake. Then the salt level, please note that the salt level should be less than 5 grams per day. Within the salt level, you have to remember how much should be the sodium. Please note that the sodium levels, it should be less than 2000 milligrams per day. And the potassium level, it should be less than 3500 milligrams per day. So that is for the sodium and the potassium. That is what is the recommended dietary allowance as well. And these are the things that you need to remember for hypertension. For coronary artery disease, one very important thing that you need to remember, coronary artery disease, or I would say metabolic syndrome. Coronary artery disease, or I would say metabolic syndrome, one very important thing for us to know is that in coronary artery disease or metabolic syndrome, there is a questionnaire how to screen for metabolic syndrome. Screening is done by something called as 3-level screening, that is a WHO STEPS performer. So WHO STEPS performer is for screening for coronary artery disease or for metabolic syndrome. That's important for you to remember. Next in line, what does the symbol stand for? What does this symbol stand for? Beta, this symbol stands for NQAS, National Quality Assurance Scheme or Strategy. National Quality Assurance Scheme. So under the National Quality Assurance Scheme, you have lot of schemes which are for quality assurance. So it is a very, like nowadays, the whole focus of the public health system in India, that is about quality assurance. So this is definitely a prospective MCQ in your exam. I don't know whether it will be directly NQAS, but it is something related to NQAS. So we have a lot of schemes for quality assurance. You should watch one of the flashcards I had shared on my Instagram and on Telegram. There was one of the flashcards which was shared regarding all the schemes which are under sub part of NQS. Just a very brief over here. I don't want to take too much of your time. You can always go back to Insta or to Telegram to see that flashcard, but just very brief over here. I would like to tell you that under the National Quality Assurance Scheme, there was one program called as Muskaan. Muskaan is for what? Muskaan Q. You see this big Q. So Muskaan is for providing child-friendly services in the government hospital. Then there was another scheme called as Lakshya. You see this Q over here. Q stands for the NQS quality assurance scheme. So Lakshya is to provide good quality of delivery services, good quality of delivery services. Then there was another scheme that is called as Sakkushal. So that is important. These schemes are important for your upcoming INICET exams. Beta, Sakkushal is basically a self-assessment tool for quality of services in the hospitals. It is a self-assessment tool. I'm sorry for my writing today. It is a self-assessment tool for quality of services, that is Sakkushal. Then you have a safe drinking water program, all with the Qs. So that Q is important. That is National Quality Assurance Program. That is what is important, National Quality Assurance Program. Okay. So next you should also know another logo. That is, what is this logo? This logo stands for ICDS. This logo stands for ICDS, Integrated Child Development Services. It is not Integrated Child Development Scheme. This is Integrated Child Development Services. Under Integrated Child Development Services, we are giving some food to the children. So essentially, who are the children who are coming to these ICDS services? That is what you already must be knowing about Anganwadi system in India. Beta, the Anganwadi system, please note that what age group of children would be entitled to come under for the Anganwadis. It is 0 to 6 years of age. So 0 till 6 years, plus they also take pregnant and lactating female, plus they also take adolescent girls. They also take adolescent girls. So these are the people who are benefited under the Anganwadi scheme. How many Anganwadis it's recommended for how much population? One Anganwadi, it is recommended for roughly around 500 to 800 population. And there is also one mini Anganwadi. Mini Anganwadi, that is from 150 to 300 population, we can establish one mini Anganwadi, and these are the people who are coming to this Anganwadi centers. Beta Aaron, it is not 1 to 6 years, it is 0 to 6 years. So what are the things they are getting? They are getting supplementary nutrition, and then they are getting non-formal education, and so on and so forth, right? So next program, that just a brief logo about over here. I think everybody should be knowing this. 1, 2, 3, 4, and 5. 5 leaves are there. 5 leaves are there, and this looks like a lotus flower. Of course, it's not by the BJP government, but of course, the main thrust was the BJP government. And but this logo is for this depicts what? So it depicts the health and wellness centers, beta. Ayushman Bharat scheme. Ayushman Bharat scheme. So under the Ayushman Bharat scheme, we have this small 2 projects. Not small, I wouldn't say small. They are in fact very huge project. They are mega projects. One is the health and wellness centers, establishment of health and wellness centers, and second is the PMJ. PMJ stands for the Pradhan Mantri Jan Arogya Yojana. Pradhan Mantri Jan Arogya Yojana, PMJ, and HWC stands for the Health and Wellness Centers. So under the Ayushman Bharat scheme, we have 2 things. We have the Health and Wellness Centers, and we have is the PMJ. So PMJ stands for Pradhan Mantri Jan Arogya Yojana, where they were giving 5 lakh rupees covered to 10 crore population families. So 10 crore families were taken. 10 crore families, they will be given up to 5 lakh rupees health insurance cover. Under health and wellness centers, we are providing a comprehensive health and wellness center. So we have a new post. What is the new post called as? It is called as CHO, that is community health officer. These are nursing officers. What is the main referral center? Who is the main referral center in the Ayushman Bharat scheme? So many times students get confused, that then they answer that, sir, it is a referral center. Humne socha it is secondary prevention, it is secondary level healthcare. So they will answer CHC, but unfortunately CHC galat ho gaya. The referral center under the Ayushman Bharat scheme, it is taken as the PHC. The medical officer PHC, listen very carefully. This is prospective for your INICET exam. The medical officer PHC, they are the nodal agencies. They are the nodal person who will be implementing the Ayushman Bharat scheme or the health and wellness center scheme across the country. So the medical officer PHC is responsible for establishing the health and wellness centers under his or her jurisdiction, and then all the sub-centers, they are upgraded to HWC by appointing one CHO. So the medical officer, they will be responsible for record keeping. They will be working as the main nodal center for all the sub-centers, health and wellness center sub-centers. Are you getting it? So please note that the primary or the main or the chief referral center for all the centers, field areas, it is coming to the PHC, and he is the main nodal agency. He will take care of the records, diagnosis, treatment, and so on and so forth for everything regarding this health and wellness centers, right? So just another brief about, that's all I think about the health and wellness centers. You should know that India has established 1.65 lakh sub-centers. They have been upgraded to the health and wellness center sub-centers with the new post of CHO, that is community health officer. That is new post of CHO with the community health officer. Next in line, what is this logo? This logo stands for the Poshan Abhiyan. We have already discussed during our discussion during our nutrition topic. We have discussed about the Poshan scheme and the Poshan Abhiyan. So this logo that you see is for Poshan Abhiyan. It is under the National Nutrition Mission. It is under the National Nutrition Mission. The Government of India, Ministry of Health and Family Welfare, they started with the Poshan Abhiyan scheme. Under the Poshan Abhiyan scheme, we are supposed to decrease low birth weight by 3% per year, and we are supposed to, low birth weight is 2% per year. Every time I get confused. Low birth weight is 2% per year, and the anemia we want to decrease is by 3% per year. So we want to decrease the anemia by 3% per year, low birth weight by 2% per year. That is what is Poshan Abhiyan. If you recall from your nutrition chapter, we talked about the Poshan Shakti Nirman scheme also, Poshan scheme also, which is under Ministry of Education, and they are providing the supplementary nutrition or the midday meal scheme. So it has been renamed as Poshan scheme, and they are providing 450 calories or 700 calories for primary school children or for upper primary school children. For detail, I would recommend you to watch the YouTube live video on nutrition, which we had discussed in the PSM Punch sessions for your INICET exam. So that was just regarding the Poshan Abhiyan. What is the full form of Poshan? Pradhan Mantri, Prime Minister, Holistic Nourishment. Pradhan Mantri overarching scheme, Prime Minister's overarching scheme for holistic nourishment. That is Poshan Abhiyan. Next is, what do you see over here? This is a typical like a picture or a screenshot I have taken for the 99 dots. What is 99 dots? That is information technology enabled compliance system. Enabled compliance system. So in this, the patient will take the tablet and give a missed call, and this is for TB compliance, TB treatment compliance. It is for TB treatment compliance. Some of the new things which are new information technology, IT enabled systems that we have in India. Beta, the IT enabled systems that we have, the biggest one is eSanjeevani. What is eSanjeevani? Many of you must be working as PHC medical officers or CHCs, and you must be working on the eSanjeevani portal. It is for telemedicine. Telemedicine is one of the main key focus areas under the Ayushman Bharat scheme or the establishment of the health and wellness centers. Then you also know about the Nikusht. Nikusht is a new software for leprosy patient notification and reporting. Nikusht, you already know there is Nikshay. Nikshay is for TB patients. Then you already know there is another IT, that is HMIS, that is Health Management Information System. That is more data should be put as electronic data rather than keeping page records or paper records. It's much better to take the electronic data because it's easy to access the data, and the people who are involved, the stakeholders, they are easily working on that data and they can change the strategies very quickly. So that is what is HMIS. All the data, all the records in India should be Health Management Information System. They should be digital records. So it is digitalization of all the medical records in India. That is HMIS, Health Management Information System. So this is the new logo. I think everybody must be knowing about this logo. This is the new logo for the tuberculosis program. It is the new logo for the National TB program. You see National TB Elimination Program, and you have a circular logo with the theme is TB Harega, Desh Jeetega. What is this logo for? What is this sweet looking, happy looking logo for? It is Shakti or Buddhi Ka Rakshak. And you have the smiley face. Just remember, whenever we see the smiley face, think of salt. That is iodization of salt. Iodization of salt, that is National Iodine Deficiency Disorder Control Program, NIDDCP, National Iodine Deficiency Disorder Control Program. Okay. Dr. K, sir, under how many days a doctor has to report the TB cases? The TB case should be reported within 1 month. Under section 297, 296, it is under the TB notification, that is Epidemic Disease Act. The TB cases should be notified within 30 days to the Government of India. Coming to this iodization of salt, beta, NIDDCP. Under this iodization of the salt, who will do the iodization of salt? The salt iodization is done by the the salt commissioner in India. So it is under the program, the iodization of salt component. So please note, that's a separate MCQ that I'm talking to you right now. The iodization of salt, who will do? So the iodization of salt will be done under the governance of salt commissioner in India, and the salt commissioner is under the Ministry of Commerce and Industries. It is under the Ministry of Commerce and Industries in India. So where is the office of the salt commissioner? The office of salt commissioner in India, it is in Jaipur in Rajasthan. So it is in Jaipur, Rajasthan, office of the salt commissioner of India, and they will ensure, that is what you had been reading, they will ensure that at the production level, that is where the salt is produced. Do you know that Gujarat and Rajasthan, these two states in India, they are contributing to 3% of the global salt intake or the salt production in the world. So 3% of the global population eats salt, which is manufactured, which is made, which is iodized in the state of Gujarat and in Rajasthan. So production, they will maintain the iodine of more than 30 parts per million. So at the production level, they will maintain at the 30 parts per million. Why do they maintain 30? Because the government wants that between you and me, there should be 15 parts per million at the consumer level. So when we consume iodine or the salt, we should get at least 15 parts per million. Okay, so that is what is NIDDCP. Lot of time frequently asked MCQs is what are the indicators in NIDDCP, indicators under the National Iodine Deficiency Disorder Control Program. Please note that the most important epidemiological indicator or the principal impact indicator, the epidemiological indicator or the principal impact indicator, what is it? It is urinary iodine excretion. So please write it on the screen. Please write it in your copy somewhere that this is very frequently asked. Principal impact indicator, that is urinary iodine excretion rate. Then is another important MCQ, that which of the following marker is a process indicator? Process indicator, that is what is, does the salt commissioner is working nicely? Yes or no? Answer is yes. It is under the iodization of salt. So iodization of salt, that is the amount of iodine in salt, that is the process indicator. And the third important indicator which is asked in your exam, that is, it is not goiter rate, beta. Dr. K, please note, it is not goiter rate, that is the principal. The principal impact indicator is UIE, it is not goiter rate. The third point is, which of the following indicator is environmental iodine deficiency? Environmental iodine deficiency or deficiency, iodine deficiency in the environment, that is in the vegetables, in the fruits, in the soil. Environmental iodine deficiency, that is given by which indicator? It is environmental iodine deficiency is given by neonatal hypothyroidism rates. It is given by the neonatal hypothyroidism rates in the area. And how do we find out the neonatal hypothyroidism rates from the area? We find out the neonatal hypothyroidism rates by assessing neonatal hypothyroidism rates by assessing the hypothyroidism rates from private hospitals. So that is what is important. Very nice, Dark Knight. Let us move to the next MCQ. The next image that you see on the screen. So this image that you see is inverted triangle. Whenever you see inverted triangle, it is a global symbol. This inverted triangle is a global symbol for National Family Planning Program, NFPP, National Family Planning Program. So what you see over here, this is a single child. So this is one child which is being held by the mother. So one child being held by the mother. So the program wants to say that one child is enough. But overall, it says that hum do hamare do. It is National Family Planning Program. What are the targets under the National Family Planning Program? Beta, this is again a prospective MCQ for your INICET exams. बाद में मत बोलना कि सर ये बताया नहीं था या हम कंफ्यूज हो गए. ये टॉपिक्स जो मैं स्टार मार्क मार रहा हूँ, प्रोस्पेक्टिव बोल रहा हूँ, उनमें से देयर इज अ प्रीटी हाई चांस दैट यू माइट गेट सम ऑफ द क्वेश्चंस इन योर अपकमिंग INICET exam. So, beta, what are the targets under the National Family Planning Program as per the 2023 data? The target is We want a couple protection rate of more than 60%. CPR stands for the couple protection rate of more than 60%. We also want a TFR, that is total fertility rate, of less than 2.1. We also want NRR, net reproduction rate, NRR of equal to 1. NRR equal to 1, what does this mean? This means there is a replacement level. There is a replacement level. NRR 1 means replacement level. TFR should be less than 2.1. CPR, couple protection rate, should be more than 60%. Alongside, alongside, you should know that what is the current value. The couple protection rate, the current value, it is 67%. So we have already achieved it. The total fertility rate, you are happy to note, it is 2.0. We have already achieved it. This can be your prospective MCQ. And yes, very nice, Dr. K. What approach do we follow in National Family Planning? The approach that we follow is called as cafeteria approach. The approach that we follow is cafeteria approach. What do you mean by cafeteria approach? That is the choice of contraception. Choice of contraception is the right of the client. So the choice of contraception should be chosen by the client. Doctor should not tell you that you take this. The client should say that, okay, I need this, I would be better with this thing. So please note that under the government of India, there is a program called as Mission Parivar Vikas, MPV, Mission Parivar Vikas. So under the Mission Parivar Vikas, we have some of the contraceptions which are available. We have is the Nirodh condoms. Then we also have is the Mala D and the Mala N tablets, that is the oral contraceptive pills. Then we also have is the intrauterine devices, that is the copper 375 and a copper T 380. Please note, copper 375 is not a copper T375. It is just a copper 375. Why? Because it is a U-shaped device. It is not a T-shape. It is inverted U-shape, right? It is inverted U-shaped device, and therefore it is not called as copper T375. It is applicable for 3 to 5 years, and it is a very safe copper device. Copper T380, it is a T-shaped device. It is valid for 10 years. And this has been very commonly used. Then you also know that we have the Antra injections. These are the medroxyprogesterone acetate injections. These are progesterone injections. Then you also know that we have is the Chaya tablets and the Easy Pill. Easy Pill or the I-Pill, these are the emergency contraceptives. Emergency contraceptive, that is Easy Pill or I-Pill. Let's look at some of the questions. Dark Knight 08, sir, which of these are available at PHC level? Everything is available at PHC level. Everything is available at PHC level. There is no contraception which is not available at PHC level. Even tubectomies can be done at PHC by the gynecologist coming over and doing tubectomies, or there are some PHCs which have a small operating room also, right? So there can be PHC it's a full-fledged functioning hospital. But if you are asked in your exam, so these all temporary methods of contraception, these are available at PHC. Sir, is it the subcenter or the PHC which maintains the records of this program? The records of this program are maintained by the MPW female. The MPW female is going to do surveys. So the PHC में से तो कोई नहीं जा रहा ना survey करने को. So of course it says that male-female eligible couple registers, they are being maintained at the subcenter level. All the records are being maintained at the subcenter levels, right? Okay. हाँ, ये ज़रूर क्वेश्चन आता है. Do you insert IUDs? Do you insert intrauterine devices at a subcenter level? Do you insert intrauterine devices at a subcenter level? Please note, IUDs cannot be inserted at a usually they cannot be inserted at a subcenter level, but of course if the MPW is trained, they can insert. So generally speaking, intrauterine devices are inserted by medical officers or even by nurses in PHCs. Okay. Okay. ये भी एक सवाल आता है, तो which are the kits which are available in different subcenters? Why did I tell you this? Because please note that kits which are available, you have the kit A, kit B and kit C which are available at a subcenter. Kit A and kit B, these are the drug kits. Whereas the kit number C, that is a maternity kit. It is a maternity kit. So it is for conducting deliveries in sub-centers. And then you have is the kit D, which is available at a PHC only. And then you have is the kit E to P, which are available at CHC. So mostly in tubectomies and all these bigger operations, they are conducted at CHC. What do you mean no? What do you mean NOO, Arun Sharma? So I couldn't get your question. Anyways, that was regarding the National Family Planning Program. Let us move to the next point. Next image that you would like to remember for your exam. What is this image? What is this image for? This image, what you see over here. This image that you see over here. Do you see in wings? There are no wings. But it looks like a parasite. It looks like a fly or something like that. This is what is, we call it as a Xenopsiella chiopis. That is what is a rat flea. Xenopsiella chiopis, that is what is a rat flea. Okay, so rat flea, it is no wings. There are wingless. It is wingless. There are no wings. And what disease does it spread? It spreads is the plague. A few points about plague. Plague has a very important propagative mode of transmission. What do you mean by propagative mode of transmission? That is, once the plague bacilli enters into the sandfly and into the rat flea, sorry, not the sandfly. Once the plague bacilli enters into the rat flea, the plague bacilli is going to propagate. There is change in number. There are a huge number of plague bacilli which are there in the rat flea. Okay. No, beta, this is not sandfly. Sandfly is something different. Dr. K, sandfly is, beta, itna पढ़ के exam से पहले from INICET exam, you can't confuse yourself with this. So sandfly, beta, ऐसा गलती नहीं करना. This is a very small, silly mistake. It can bring you down from Department of Radiology to Department of PSM or Biochemistry or Anatomy, whatever. So at least radiology नहीं मिलेगा अगर ऐसी गलतियां करोगे. So these are big blunder mistakes. ये sandfly थोड़ी ना. Sandfly is a fly, है ना? Fly तो आप, when do you say a fly? Fly होता है जब wings होते हैं. That is why I told you the first thing. Do you see the wings? No wings are there. Sandfly में there are wings. That is why it is called as sandfly. But the point in sandfly is, sandfly में point जो याद रखने वाला है, that is the sandfly cannot fly. Why? Not because it does not have wings. Wings है तभी तो इसको fly कह रहे हैं. Sandfly cannot fly because the wings are not good shape. They are lanceolate shape. अच्छा, मैं कुछ बात कर रहा था about important points about plague. So plague, what is the mode of transmission? It has a propagative mode of transmission. In plague, what is the earliest warning sign? The earliest warning sign, that is the death of rats. So death of rats or the rat fall, that is known as the earliest warning sign for plague epidemic. So also you should know that in plague, what spreads plague? That is a full blocked flea that is going to spread the plague. It is a partially blocked flea. Partially blocked flea is always more dangerous than a completely blocked flea. So partially blocked fleas are going to live for longer time and they are going to spread a lot. So please note that these are this is important points about plague that you should be knowing. Next in line, what do you see over here? What I see over here is a vaccine vial monitor. So under the vaccine vial monitor, you have outer circle and inner square. And this, I think I have told it a lot of times in your previous modules also, that in the vaccine vial monitor, which this VVM is there on which vial at what site. So you should note that if the VVM on the vaccine vial monitor on the vial is on the cap or on the neck of the vial, neck of ampule, or on the cap of the vial, that means that once you open this vial, listen very carefully, this is prospective MCQ. If you open this vial, because the VVM was there on the cap or on the neck, now you open this vial, now this vial cannot be reused. So if opened, no reuse is possible. If opened, no reuse is possible if the VVM is on the neck or the cap, because you can't close it back, right? But if the VVM is on body of ampule, that means it can be reused if kept in optimum temperature. If kept in optimum temperature, it can be used. What is the optimum temperature? That is 2 to 8 degree Celsius. So the vaccines should be kept in 2 to 8 degrees Celsius. And what is the discard point? I think the whole country should be knowing that the discard point is, you should be knowing that the discard point is option number D and option number E. So which vaccines are under the open vial policy? So which vaccines are under the open vial policy? Which vaccines are under the open vial policy? Please note, all vaccines can be used till 28 days after opening. If they are kept in proper time, except which one? It is measles, rubella and BCG. These are the 2 vaccines, and COVID-19. These are the 3 vaccines which cannot be kept for longer time. If they are opened, they have to be used. So absolutely correct, Arun Sharma. Rotavirus recently changed VVM to the body. Next in line, what do you see over here? What image do you see over here? What is this image? This is a clear, typical image for something called as chloroscope or a chlorimeter. In this, the reagent, what is the name of the reagent that you use to check for the water quality or the chlorine level? So the chlorine levels or the water quality reagent is the chlorination reagent that you use is called as orthotolidine. It is called as orthotolidine. Please note, orthotolidine will tell you what MCQ over here. Orthotolidine tells you about the free and the combined residual chlorines. It tells us about the free and combined chlorines together. Please note, there are 2 things that are there. Very frequently students get confused. Please note, there is something called as FRC and there is CRC. FRC stands for the free, just a moment, I'll just take this sleeve off the pen because this sleeve was disturbing. So FRC stands for the free, it stands for the free residual chlorine, whereas CRC stands for the combined residual chlorine. Please note that these are 2 different things. You have the free and the combined residual chlorine. So they both are, the point is they both are residual chlorines. So either they can be free or they can be combined residual chlorine. So now what does the orthotolidine test tell you? What does the OT test? It tells you about the FRC and CRC both combined together. So it tells us about the together FRC and CRC. Whereas we have orthotolidine arsenate test. We have another test that is called as orthotolidine arsenate test. Under the orthotolidine arsenate test, we are checking about the FRC and CRC separately. So separately we are checking for the FRC and the CRC. That is what is important. So एक पिछले question में from the previous question there was one of the doubt which was asked by Dark Knight 08. So Dark Knight 08, सर जेई का क्या करना है? बेटा ये भी मैंने पुराने इम्यूनाइजेशन के टॉपिक में बात किया था. I already talked about Japanese encephalitis. That Japanese encephalitis, initially it was what we were giving was a live vaccine, but now we have moved over to the killed vaccine. The killed vaccine is intramuscular vaccine, and there is it is under open vial policy. It is now used under the open vial policy, and it is possible to use the vaccine once you reopen the vaccine. Coming back to the orthotolidine test, this is what you see over here is the chloroscope, and chloroscope is what is with the orthotolidine reagent. What do you see over here? What is this graph? What do you think? What is this graph? This graph, it stands for the Venn diagrams. Please note that the Venn diagrams are for overlapping qualitative data. They are for overlapping qualitative data. Please also note there are some points I would like to tell you in biostats. You already have learnt about them. Please note for your INICET exam, if you are appearing for your INICET exam, some points I would like to tell you. You should note what is a Kaplan-Meier survival analysis. Kaplan-Meier survival analysis. Kaplan-Meier survival analysis, it is for Kaplan-Meier graphs. They are made for survival analysis. It is to find out that how much longevity is there with some intervention, what is the increase in the lifespan. You should also know there is something called as kappa stats. What are the use of kappa stats? It is to check for level of agreement between two observers. So between two observers, if there are researcher 1 and researcher 2, we are going to check for the level of agreement. We are going to check for the level of agreement. For that we use a special stats that is called as kappa stats. Next is, what do you mean by forest plot? Forest plot. Beta, please note that forest plot, they are used in meta-analysis. And in meta-analysis we draw the forest plot, and this tells us about the final effect of the drug or the intervention or the risk factor. Then you should also note there is something called as funnel plot. So that is, sometimes students get confused that what is forest plot, what is funnel plot. Funnel plot is used to find out a special bias called as the publication bias. So what happens is there are some types of studies. There are some type of studies which are published more in certain journals. So certain journals have a predilection, they have a propensity, they have a tendency to publish more types of studies on a particular topic or more positive studies. So that is what is funnel plot. Funnel plot should always be, we discussed about this in epidemiology. So funnel plot is something like this. The studies should always be equal on both sides. If you see a study like this, if you see a funnel plot like this, where there are more studies over here and very few studies on the other side, so that means this is what is a publication bias. Publication bias, that is only one type of studies were being published, the other type of studies were not published. Usually it is said that both types of, like, there should be positive studies and there should be negative studies all the time. So some studies should show positive effects, some studies should show a negative, some studies should show a negative. It went like the tongue twister. So some studies should show like negative effect, so it becomes like a tongue twister. Anyways, so that was just on a lighter note. So that is what is publication bias, beta. Funnel plot, please note publication bias or the funnel plot. Then you should also note what is Dixon Q test. What do you mean by a Dixon Q test? Dixon Q test, it is done to find the outliers, Next is, you should also note what do we mean by a Kolmogorov test. Kolmogorov test, that is to find the normalcy, of data. To find if the data is normally distributed, yes or no, we do a test that is called as Kolmogorov test. Then you have is the Dixon Q test. Then is, you should also note what do you mean by Cochrane. This has been recently talk of the town. What is a Cochrane? Cochrane is a collection. It is online collection. It is online collection of systematic reviews. It is online collection of systematic reviews, and that is what is Cochrane. So it's pretty important for us to remember about these small silly things which are sometimes asked in your exam. What do you see over here, beta? What do you see over here? This is called as a correlation curve or a scatter plot. Scatter plot. You should also note that there is something called as regression analysis. A few points about regressions. What do you mean by regression? So regression is when you extrapolate, beta. Extrapolate a graph. If you extrapolate a graph, let us say you know this point, you know this point, you know this point. So you know these points. Now I ask you that what is happening at this particular point. So common sense, you know that this is what is this point. or I ask you what is happening at this point, so you can extrapolate it either way. Are you getting it? So you can either go on this side, you can go on this side. So it will be dependent on what? It will be dependent on the angle, it will be dependent on the degree of the slope, and so on. So that is what is regression analysis. In regression analysis, we can take multiple types of regressions. Please note that regression analysis, it can be of many types. You can have a single variable, you can take a univariate. Univariate means you are taking one variable and you are finding out what happens with the other. Or you can take multiple variables, multivariate analysis. We can also do some very important lesson. We can also have something called as linear regressions, or we can have logistic regressions. What do you mean by linear? Linear means the data was a quantitative data or a parametric data. Logistic means the data that is in question, that is a qualitative data. So that means that we can have univariate linear, univariate logistic, multivariate linear, multivariate logistic. You can have different permutations, combinations. So yes, definitely Dr. K, absolutely correct that he has given y is equal to a plus bx. That is the equation that goes with the linear equation, univariate linear equation. That is this is the constant, and then you have the variables, and this is what is the regression finding that you see over here. What is b? B is the slope of curve. That is what is b. That is what is b. X is one variable, y is the other variable which you were about to find out. So that is what is regression. Coming back to the story about scatter plots. Scatter plots is always between two variables, always between two variables. So whenever you have many variables, you want to find the final outcome of the scatter, you just simply average them. So the scatters, it can be a negative scatter or a negative correlation, or it can have a no correlation, or it can also have a positive correlation. So we can have different types of correlations. We can have a negative correlation, positive correlation, or no correlation, where you cannot find any like correlation between them. We can also have something called as like parabolic, or we can have different shapes, that is called as non-linear correlations, and these are given the special names. These are called as Spearman correlations, beta. Please note that all the linear correlations, that is what Arun Sharma was saying about the coefficient of correlation. These are all linear correlations. These are called as Pearson's correlation. So please note that Pearson correlation is a linear correlation, whereas the Spearman correlation, that is a non-linear correlation. So please note, Pearson correlations is linear and Spearman correlation is non-linear. So absolutely correct. It is -1 to +1. The Pearson correlation, this also you should note that the Pearson correlation, it ranges from -1, it ranges till +1. So -1, it is called as a negative correlation, and +1, it is called as a positive correlation, and the Pearson correlation could also be 0, which means a no correlation. It means a no correlation. So very nice. Let us move to just a few more points, and that will be all for the day. What is this over here? What is this over here? What do you see over here? What is this? What is this image? This is what I was saying, this is inverted U-shaped device. This is what is a copper 375. And copper 375, you only have the copper on stem. You only have copper on the stem, and on the arms, you see these arms, the arms are without any copper. So on the arms, you have some finger-like projections. These are called as stubs. These are called as stubs. These are finger-like projections, and they just help in better attachment to the uterine myometrium. That please Olaf, this is not copper T device. यही गलती मैंने आपसे करवानी थी. So please note, copper T device nahi hai. This is copper 375. It is a multi-load device. It is a multi-load device. It is a multi-load device, and it is applicable for 5 years. We have already discussed this. What is this logo for? This logo. What is this logo for? This logo is for, sorry. This logo is for Pradhan Mantri, Prime Minister, Surakshit Matritva Abhiyan. Prime Minister Surakshit Matritva Abhiyan. It is for Prime Minister Surakshit Matritva Abhiyan. So please note this is PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan. And in the Pradhan Mantri Surakshit Matritva Abhiyan, you are supposed to do what? We are do screening in ANC. So screening of the female during her ANC, we are doing Pradhan Mantri Surakshit Matritva Abhiyan. This is free ANC on 9th of every month. Very nice, free ANC on 9th of every month. Just very quick pearls over here. What is this logo for? What do you think is this? What do you think is this? This is beta a logo for INAP. This is the logo for INAP. 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 INAP stands for India Newborn Action Plan. India Newborn Action Plan. Under the India Newborn Action Plan, we want to have a single digit. We want to have a single digit for neonatal mortality rate, and we want to have a single digit for the stillbirth rate. Stillbirth rate and neonatal mortality rate, they should be less than 10. That is what is single digit, na 1 to 9 hona chahiye. That is what is 1 to 9. This is India Newborn Action Plan, that is INAP. So Navratilova Shishu. Navjat Shishu probably he wanted to write. So Navjat है ना? Navratilova, ये तो कोई Russian name सा हो गया. So Navjat Shishu, yes, this looks like a Navjat Shishu lying in the lap of the mother. This is not Navjat Shishu program. This is INAP. बच्चा सो रहा है, बच्चा napping, है ना? That's how I have remembered, बच्चा napping. This is INAP, India Newborn Action Plan, to bring down the neonatal mortalities and the stillbirth rate to less than 10. What is this logo for? What is this logo for? The other logo, let us just go to the other logo. What is this logo for? The other one where you see the person with a kite. So what is this logo for? The other logo is for, please note, RKSK. The other logo, it is for RKSK. Let us just increase this. What is this logo for? Let's delete this. What is this logo for? Absolutely correct. This is RKSK. RKSK. RKSK, Rashtriya Kishore Swasthya कार्यक्रम. In Rashtriya Kishore Swasthya कार्यक्रम, Rashtriya Kishore Swasthya कार्यक्रम. In Rashtriya Kishore Swasthya कार्यक्रम, please remember K for kite, K for Kishore, and it is for adolescent children. It is for adolescent children where they are giving weekly iron folic acid supplements, vocational training, they are given supplementary nutrition, they are given food grains, and it is for both adolescent boys and girls. It is for both boys and for girls. It is for both adolescent boys and for girls. It is not only for girls. You can see this is a child, young adolescent or a young child, and then you see adolescent girl, and then you see adolescent boy. It is giving weekly iron folic acid supplements, menstrual hygiene, and so on. So let's move to the next topic, our next point. This is, what is this logo? This logo also pertains to some of the child development program, and this is related to the under 5 clinics. So in the under 5 clinic, beta, the approach is to give them health education, care in illness, family planning, monitor growth, and preventive care. How many components you see? 5 components. Within the 5 component, which is the core component, the core component is family planning. But which is the most important or the largest component? The largest or the most important component is for health education. That is the only MCQ you get in under 5 clinic. Next in line, what do you see over here? This is what you see is Argemone mexicana flower. This is what you see as Argemone mexicana flower. This is what is Argemone mexicana flower, and the Argemone mexicana, it is actually a weed. This weed will grow or may grow in areas where there is mustard field production. Mustard field is there, right? So in mustard field, what is this disease it causes? It leads to epidemic dropsy. Please note, it leads to epidemic dropsy. What is the toxin in epidemic dropsy? Dropsy, you remember, it is with word liquid. So drop is with drop. Drop is liquid. The toxin is sanguinarin, that is marine. The disease is epidemic dropsy, and the flower is Argemone mexicana. And in this, what are the clinical features? It causes water everywhere. Water in your eyes, glaucoma, water in your heart, congestive cardiac failure, water in your feet, that is pedal edema, water in the stomach, that is ascites, water in the chest, that is pleural effusion. So there is water everywhere. This disease, you can remember it with the word liquid. So the disease is liquid. The toxin is sanguinarin or sanguimarine. That is what is the toxin, and that is the clinical features. And how do you prevent this disease? Argemone intoxication or Argemone mexicana intoxication, it cannot be prevented. Vitamin C, beta Olaf, confuse हो रहे हो, vitamin C was with neurolathyrism. यहाँ पे the only way for prevention is de-weeding. De-weeding कर दो, ये plant को बाहर निकाल के फेंक दीजिए. That is the only and the best way. Next is, what is this logo for? What is this logo for? This logo is for SANS. What is SANS for? Logo is for SANS. What is this SANS for? Parboiling भी K, Dr. K, ये आप confuse हो रहे हो यार. Parboiling was also with the neurolathyrism. Last image that we are going to discuss today, that what is SANS? SANS lena. What is this SANS? SANS, any idea? Any idea what is this SANS program or the SANS guidelines for? SANS guideline, that is to prevent pneumonias. Beta, please note, it is to prevent pneumonias in India. So pneumonia prevention it's again a prospective MCQ which can be asked in your exam. So SANS is for providing the pneumonia guidelines. You already know that in the WHO guidelines, please listen very carefully now. In the WHO guidelines, the chest indrawing, the chest indrawing is taken as pneumonia, and they give oral amoxicillin. But in India, the guidelines for SANS, that is for children under age of 5 years, the SANS guideline is again that the same thing, that chest indrawing is taken as severe in pneumonia, and we tend to be aggressive in the management, because in India the pneumonia, the chance of a child to die because of pneumonia is very, very high. So WHO is of course giving for generalized guidelines for the countries, right? So India is still adopting its own guidelines. We have made our own SANS guidelines. So detail of this is already there. Detail is already there on my website. I have discussed this a lot of times in your Marrow modules also. So please note that you study the SANS guidelines and you go for your exam. If you have not studied the SANS guidelines, just go to this website, beta, psmsimplified.com. It is my website, and on this website I have given the document. This document was uploaded in year 2020. So that is the SANS guideline 2020, and they're still hanging around with the same guidelines. So that is for managing the children with pneumonias at lower field level, subcenter level, and at PHC level. So please note that what is the target of SANS? The target of SANS, what is the full form of SANS? SANS stands for Social Awareness and Actions to Neutralize Pneumonia Successfully. That's a fancy name. SANS is social awareness and action to neutralize pneumonia successfully. That is full form of SANS. What is the full form? It's written here. SANS is social awareness and actions to neutralize pneumonia successfully. So in this SANS, of course, they are using clean LPG like fuel should be used, minimize use of firewood and all that. You remember that Ujjwala scheme. Scheme under the Prime Minister action scheme for providing safer LPG fuels. But what is the target? The target is to achieve, very important, this could be a prospective MCQ beta. The target is to achieve pneumonia deaths. It is deaths due to pneumonia. It is deaths or mortality due to pneumonia. Death due to pneumonia should be less than how much? Bolo mere saath, it should be less than 3,000, less than 3 per 1,000. So deaths due to pneumonia, they have to be decreased to less than 3 per 1,000 live births by year 2025. It is one of the very important SANS program. It has been scaled up till 2023, and of course it was till February 2023, but it has been taken up again. So that was all regarding the SANS guidelines and the pneumonia guidelines, and please go to the website and you can just watch this. You can see this PDF document already there on my website, psmsimplified.com. Go to the topic of updates, go to the section of updates, and within the updates you will find a lot of PDFs. So with that, I'd like to thank you for your time today, and I want to wish you all the very best, all the big best, all the very, very best for your INICET upcoming exam, beta. See, you have done your bit. You have already put in all the efforts that you have. So you have put in all the efforts. What is my last thing? So what is my last thing is that in these next 3-4 days, please stay very, very calm. Do not panic. Whatever you have done the best. Just revise that. Do previous INI set questions very importantly. And the rare questions like reorder level का एक question आया था 2-3 साल पहले आया था. That question will not be repeated again. These are rare questions. They don't keep on coming. जो already repeat topics हैं like correlation से बहुत questions आते हैं. Meta analysis is frequently asked. Evidence based medicine is frequently asked. Epidemiology is very frequently asked. Public healthcare system in India is very frequently asked. Biomedical waste management is asked. ESI is asked. These are things which are very, very important to us. एंड ये सारी चीज़ें बहुत दफ़ा पूछी जाती हैं. ये जो इक्का दुक्का रेयर क्वेश्चंस है लाइक एपिडेमियोलॉजी में यू मस्ट हैव सीन द प्रीवियस INI सेट क्वेश्चंस जहाँ पे हमने बात की अबाउट द कंपोनेंट एपिडेमियोलॉजिकल चार्ट्स. यू माइट हैव सीन वो ऐसा ऐसा करके था. कंपोनेंट चार्ट्स कहते हैं, कंपोनेंट चार्ट्स. So component charts, I don't know, it won't be repeated again. Reorder level है, reorder level ये question कभी भी नहीं दोबारा आएगा. Component charts, pie charts है ये कभी भी नहीं दोबारा आएगा. So these are topics which won't be repeated. So make sure that you are choosing wisely what you are going to do again for your exams. Of course, it is always said that INICET is going to take the repeat set of topics, but there are few questions which are never going to be repeated, and make sure you don't put a lot of time or waste a lot of time in that. Okay, so the best way to contact me for any doubts in your community medicine is Telegram group. I try to be fairly active on the Telegram group. So if for any doubts, beta, you are always very welcome to log into this Telegram group. There might be some students who do not have Telegram group, then you can talk to me on the Facebook, or of course all the Marrow users, you have a wonderful Marrow Links channel or the group on the Facebook. So you're very welcome to ask on that. Now is very important is for all the updates, beta. All the updates you can follow me on Instagram. Of course, at this junction of time, you should be very much bothered about your INICET exam coming in the next few days. So make sure that this exam is the last exam that you are giving. You should try your very, very best and you are supposed to clear it. एंड ऐसा भी नहीं है कि अगर क्लियर नहीं हुआ तो जी ये हो जाएगा वो हो जाएगा, ऐसा कुछ नहीं होगा. स्टे गो विद वेरी कूल माइंड. यू हैव डन योर बेस्ट. बस ये मेरा आपको बार बार यही बोल रहा हूँ. यू हैव डन योर बेस्ट. नाउ यू आर जस्ट गोइंग टू रीप द बेनिफिट्स ऑफ दैट. सो ट्रस्ट योर सेल्फ, ट्रस्ट योर इनर इंस्टिंक्ट्स. जस्ट कीप ऑन रिवाइजिंग, नथिंग न्यू. मैंने आपको देखा होगा इनमें से कुछ भी नया नहीं करवाया. एवरीथिंग यू हैव ऑलरेडी नोन, यू ऑलरेडी डू इट. सो उसमें गलतियां नहीं चाहिए आपसे. बस यही मेरी भगवान से प्रेयर्स है. आई सिंसियरली प्रे टू गॉड कि आपका एग्ज़ाम क्लियर हो एंड यू शुड कम अप विथ फ्लाइंग कलर्स. एंड कभी जब हम बाद में मिले तो आप ये बोलो कि हाँ सर मैं यहाँ पे खड़ा हूँ. दैट टाइम आई विल फील वेरी प्राउड एंड आई विल बी फीलिंग कि येस आई हैव डन माई बिट इन हेल्पिंग यू गो थ्रू दिस जर्नी. So my main motive is just to be a good part in your journey, है ना. So all the very best, beta. Take care and keep on pushing yourself. पढ़ते रहो, रिवाइज करते रहो, नया कुछ नहीं छेड़ना. एंड आई नो यू विल बी क्लियरिंग दिस एग्जाम. ऑल दी वेरी वेरी best for your exam. All the very, very best for your exam. So come out with a smiley face and flying colors. Thank you so much, beta. Thank you so much. All the very best and have a very good night. Any doubts, you're very welcome to ask it on the Telegram group. Okay? Chalo. All the best, beta. All the best. Bye-bye.